hepatitis C, I want to talk a little bit about how it came on my radar. Hepatitis C, always, it's a reportable disease in Kentucky. It has to be reported to the health department. It's something that's, ever since hepatitis C has existed, it's something that it reports at. We look at on a monthly basis to see, okay, what kind of infectious diseases are popping up in our district. Around 2010, myself and Joyce Rice started to notice that the first month in 2010, we started to get these little blips on the screen, as we called them. These little spikes, all of a sudden, on a daily basis, we started to get hepatitis C results coming in. And so we would call the lab and say, is this correct? Or, are you sure? Especially when we saw the lab reports and people's ages were 19, 21, 17, 15. When you think of hepatitis C, that's not the population that you think of. But we started to see this. So we watched it for another month, and the trend continued. On the third month, it was after we knew that we had something to deal with. Something was happening. We didn't know what it was. We knew that the baby boomer population, was getting older. Maybe that was it. Maybe they're just starting to get screened and they're having symptoms, and that's why they're seeking out health care. But then we started looking at and started doing research. And we contacted CDC. And we said, what is going on? Is it nationwide? Is it just Kentucky? Kind of what is. And CDC told us that hepatitis C was on the national trend to be the most rapidly increasing infectious disease so far. They just kind of told us to stay put. Keep monitoring it, keep educating it, keep testing. And we said, we don't test for hepatitis C in northern Kentucky. We don't have the funding to do that. We can't do it on site. It's very expensive. So we didn't hear from them for a while. I would say 3 or 4 months went by. And so what we started to do was actually look at, for hepatitis C, who's at high risk for that? Obviously the number one is people who inject drugs. When you share needles and you inject drugs, obviously the transmission is back and forth. Not only for hepatitis C, you have HIV, you have the other, you can have syphilis. I mean, there's a number of different diseases that you can get. We didn't really have that big of an issue in northern Kentucky. In my history with IV drug use, it's always there. It's always in the underground, but it wasn't like really prevalent for that. So that kind of stayed on our radar too.